I talk to every resident that comes here. Every potential resident that comes here. I interview all of them. I make a point of trying to get to know all of them. And I try to tell them the things that are going to be important to their development. The first of those is that they need to have clinical training, and the patients, both in the number and the complexity that walk through our doors, are unsurpassed.
I decided I wanted to be a surgeon during my third year of medical school, and I remember walking into one of my mentor's office saying, "Where is the best place? I want to go to the #1 program to train for surgery." And I had my whole list, and I thought I had Harvard and Duke and Johns Hopkins, and he looked at me and he said, "Okay, if you want to be a surgeon, you have to go to Michigan."
The Department of Surgery at the University of Michigan was founded in 1850 and is nationally recognized for excellence. The surgical heritage at the University of Michigan is unusually strong and associated with such names as Charles Denancreed, Hugh Cabot, John Alexander, Cameron Haight, Reed Nesbitt, Frederick Collar, and C. Gardner Child III. There are over 100 full-time faculty members, including basic scientists in biochemistry, immunology, bioengineering, and physiology, whose expertise enriches many areas of investigation. The training programs in surgery at the University of Michigan have the highest priority with our faculty and include approved programs in general surgery, surgical critical care, pediatric surgery, plastic and reconstructive surgery, cardiothoracic surgery, and vascular surgery. Our programs gain their strength not only from the breadth and variety of clinical experience to which our residents are exposed, but also from the close working relationship between residents and faculty.
The faculty have a true dedication to teaching the residents to be doctors, to be surgeons. And that consensus about what we're about is difficult to find.
I think one of the main strengths of the University of Michigan, and the reason that I encourage people to train here if they have the option, is that we make a commitment to each trainee to develop them to the maximum capacity that they are capable of.
When I interviewed here, a lot of my research that I had done in medical school and the mentors I had built relationships with in medical school were cardiothoracic surgeons, both cardiac and general thoracic. And so I was pretty sure that's what I was going to do. But things change.
We aren't trying to create cookie cutter chief residents who all finish with the same sets of skills and the same capabilities. We're trying to take each individual trainee and develop them to the best way possible.
One of the things we pay a lot of attention to is making sure that residents get an early and frequent operative experience. Simulation training has helped us in achieving that by sort of pre-arming residents with skills so that they are functioning at a higher level in the operating room. We've been able to show this as an effect of the training we have.
I tell people a lot of times that an hour of your time down here is equal to 3 hours of time in the classroom with an instructor, because you really get true hands-on learning. And so it involves everything: the cognitive, the psychomotor, the critical thinking skills. All of those things play into this kind of simulation down here.
In addition to this strong foundation in clinical surgery, the programs encourage a structured exposure to laboratory and/or clinical research. Most general surgery residents elect to spend 2 years in a preceptorship with a faculty member in surgical research. This experience is available after the 3rd year of residency training.
To me, surgical research is vitally important to us as physicians because we always need to be involved in advancing the field of medicine.
My research year, when we all went into the lab, the 7 of us that were interns, I think, 6 out of the 7 of us are actually in an academic setting. 1 went into private practice, so I think it had a huge influence on our class and many other residents after that. And it's a growing period too, because you find out what you're interested in and whether it matches up with what you want to do long term.
Research experience is optional in the residency program. However, it is strongly encouraged. The research experience is planned individually for each resident and is dependent on career goals and previous experience. In recent years, some residents have also acquired advanced degrees, such as a PhD, MPH, or MBA from the University of Michigan during their research time.
The most amazing thing about those 2 years was that we would be performing physiologic research with liquid ventilation on animals one day, and the very next day your pager would go off to go to the intensive care unit to do liquid ventilation on patients.
Being able to do these things, to bring together the insights from the clinical arena with the insights from the basic science laboratory, is an immense challenge, one that cannot be overemphasized. And Michigan, in my view, is the leading place in the United States, possibly in the world, to be able to bring the insights from those two arenas together in the same place and same time.
For me, Michigan, as a surgical residency, was the place that offered everything I wanted, in that it had a very strong clinical program that provided the full breadth of general surgery, and it also had a lot of research opportunities and research mentors to help develop a potential academic career.
Well, I think we always learn from the people who taught us, and I try to take the lessons I learned from the excellent mentorship I have and try to use those same skills to mentor other young faculty and residents so they can be successful in the academic arena.
About 40% of the faculty in our department now are women, far above the national average. My goal is to have it be about half women, because half of the talented people in the world are women.
Ann Arbor is unique from other places that I lived. I've always lived in big cities, and it is a college town with perks.
My favorite thing about Ann Arbor is probably art fair in the summer and football in the fall.
And two, it's a young town in that there's not only college students, but a lot of kind of young professionals, graduate students. So it's a vibrant place to be.
It's obviously a great thing to be around during football season and the wonderful weather in the fall.
Downtown is nice. There's a lot of activities, and it's beautiful in the spring and the fall and in the summer.
We make an enormous effort to try to find the brightest people, the people with the biggest ambition, the people with the greatest sense of themselves, and the people with the best sense of humor and humility and normalcy in our residency, because exactly the same thing is what we want in our faculty.
Why did I decide to come to the University of Michigan for surgical residency? It was really the best place, when I was coming out of medical school, the best place for clinical training and research. It offered probably the best breadth and depth of clinical experience that I could find, in conjunction with the best opportunities for research.
For the last 10 years, the Department of Surgery at Michigan has placed more faculty members into other departments of surgery than any other department in this country. And if you go as a medical student from Michigan to interview at Pittsburgh or at Duke or at Hopkins or UCLA, you meet faculty members that trained here. I'm proud of that.